Turf toe injuries or sprains of the first metatarsal phalangeal joint can be debilitating. This taping aims to limit extension of the joint, which is the provocative movement when one has this injury. To get good stabilization, we need to effectively splint the toe in a neutral position. To accomplish this, we will need to anchor around the distal phalanx. However, we need to take great care in protecting the nail of the toe from the tape. In consideration of this, we will place a small amount of pre-wrap or a small band-aid over the nail to avoid the tape adhering to the nail. A narrow strip or two of tape are then placed as an anchor on the great toe. Next, we need to place an anchor around the foot. Being that we are working on the forefoot, we need to leave a channel open on the top of the foot to allow for spreading of the forefoot and toes. We put a bridge strip across the gap on the top of the foot to complete the anchor. Plan to use at least 2 strips on the foot anchor, but larger feet may require 3. Placing the MTP joint in a neutral or a scant bit of flexion, measure the length of tape needed to span from anchor to anchor. On a side work surface, make a small fan with at least 3 strips, similar to those used in Achilles tapings. Remember to bias the intersection of the strips to one end, as the toe does not require as much surface area as the foot end of the fan. Carefully apply the fan to the great toe, being mindful not to overshoot the anchor. Fix the distal end of the fan to the toe first. Position the MTP joint in the desired angle, being careful not to flex the IP joint of the toe itself. Lay the proximal end of the fan to the proximal anchor and secure in place. We never want to have tape ends on the bottom of the foot. Keep this in mind as you are laying down your last bridge strips. Finish the taping by checking your work. This taping should limit painful extension of the great toe.